So it looks like you are currently under the care of a physician, Jennifer Shaw, is that correct? Okay. Just want to verify her phone number. It's 509-842-3900. Perfect. And her address is still 1004 South Monroe Street, correct? And then we're just going to go over your medications today as well. So you're on sertraline, correct? And it's 150 milligrams once a day, right? And that's for depression, correct? Okay. And then melatonin as well, 10 milligrams once a day for sleep, right? Okay. And then dapsone, you said unknown amount. Is it usually like a pea size?
Yeah,
tiny
like,
bit?
yeah, like
yeah. Cool. And that's twice a day, right? Okay. And then we have tetranolone, which is also
a pea size.
And then we have magnesium, which is the 400 milligrams once a day vitamin, correct? Perfect. And then you're not taking any medications for osteoporosis or Paget's disease? No. Are you taking birth control pills? And then you said that you have penicillin and amoxicillin allergies. What kind of reactions do you typically get with those?
A rash and like an upset stomach.
Okay. But as far as you know, when was your last reaction to that?
3 years ago.
3 years ago?
Yeah.
I'm gonna add that in here. 3 years ago. And do you know if it was, which one it was, amoxicillin or penicillin?
It was penicillin.
And you said a rash, correct? And then you said an upset stomach, correct too? Okay. Running through the rest of your medical history. No history of heart conditions, respiratory conditions, like asthma or bronchitis. And then no anemia or blood issues, correct? And you said you're diagnosed in spring of 2023 with sertraline, and that was just for depression or for anxiety? Okay. And then you've had no A1C disorders like diabetes, eating disorders, something like that? You have none of those either? Okay, awesome. Thanks for letting me review your health history today. Hi, this is my reflection of my ASA Class 2 patient video assignment. Looking at the rubric for professionalism, I believe that I did show competency in having like my tone and my appearance. I was in my PPE. In my body language, I was facing the computer most of the time, but I would look at the patient when I had my questions, and I would just like reassure, like, okay, is that what you're saying? And then I did get consent signed, so I followed ethical considerations. I displayed that form at the beginning of the video, so you could see that I did acquire consent to take this video. As far as individualized care and questioning, I believe I did show competency in that as well. I communicated effectively with my patient concerning like their medications. That was the big concern for them, was just making sure I had the right dosage and the right frequency in for the medications. And then my patient did not need like a med consult prior to treatment, but the reason why they are in ASA Class 2 is because of their BMI, and I'll display the health history form to kind of show that. But so they have a really high BMI, which just places them in the ASA Class 2 category. And then after I completed reviewing the medical history, there was also, like, when I obtained like all of her vitals, She did have a stage 1 blood pressure reading, so I did create a referral for that as well. I didn't video that conversation with it, but I did explain to her like the importance of lowering her blood pressure just for her overall like cardiovascular health, and I encouraged her to follow up on that referral and see about getting a physician to help treat that, because that seemed as if it was a pretty typical reading for her. And I had her, so her first appointment, I took her blood pressure, it was stage 1, so we kind of were determining if that was like her normal blood pressure. And then the second appointment she came in for, which is when I reviewed her health history with her again, that's when we discussed that blood pressure, because it seemed as if it was a more consistent reading. It wasn't just like a anxiety induced or stress induced high blood pressure. It seemed as if that was like her normal state. So we did create a referral for that, and I did link that in my video as well, so you can see that too. As far as mastery of the subject matter, I believe I show competency in that as well. I exhibited the understanding of medical and oral conditions. So my patient didn't have a condition, but since it was the BMI, we did do nutritional counseling following that that interaction, just to kind of discuss like ways in which we can improve our diet and like goals we can set. Their goal was just to like try and eat less processed foods. I also did use relevant questions related to like her medications and her conditions too, like by conducting nutritional counseling using motivational interviewing. That helped to like ask follow-up questions concerning that as well. Seeing that she wasn't being treated currently for hypertension, I didn't have like all the follow-up questions for that. I wasn't able to ask like what medication she was on. And then I did use like some leading questions to help like further my information. So when I asked about like her medications, I like asked specific questions about like the dosage, and if she couldn't specify a dosage, like she had a couple medications that were like topical creams, I would ask like a visual amount. Like I believe in her response she said it like a pea size amount, just like a little tiny bit, so that helped me to like gauge like how I can like write that in her health history form. And that was kind of the same for like other medications too, like even oral medications she was consuming, like just asking follow-up information about like the frequency, like if they take it with a meal, not with a meal, or like if it's once a day, 2 times a day, or is it like you take it periodically, like if it's just like when you feel like you need it, like if it's like a stress or anxiety induced like thing where it's like, okay, if I feel anxious, I'm gonna take this medication now, stuff like that. And I believe I'm showing competency right now in my reflection by evaluating my performance. I do think I could have been better about like just facing the patient directly. Even though I did turn my head like towards my patient, I felt that I could have just like been better at like looking at the computer facing them, so that way they like felt like they might have been more of a collaborator in the conversation, not just like an interview. So I do feel like I could have been better about that. One of the successes I had, I felt that I got clear answers from my patient. There wasn't a lot of the leading questions I asked were clear, so my patient was able to easily answer those questions in a quick manner, but also a quick and a clear manner. So in asking clear questions, I was able to get clear responses. I could have also lowered my mask so that they could have felt like I was more relatable and more like humane, I guess, or human. Sometimes I feel like when you have the PPE on, it's hard to understand that there's a person in there and not just like a healthcare provider. It's like, no, they're a person, they want to help you. So I wish I had done that differently for my patient. Considering the time requirement, I know that my health history review video doesn't exceed or doesn't meet the 8-minute minimum time limit. But I believe that in the amount of time that I did interview my patient, I got to like know my patient more, and I got to understand their like medications, and also how some of those medications are risk factors for like like cavities and periodontitis. Other things too can like interact with anesthesia. My patient didn't need anesthetic that day, but just like in the future, just knowing like, okay, like I need to be cautious when administering anesthetic with this patient, if they're taking this medication. But it also helped me to understand too, like what things I can help my patient with and what things I can refer my patient out with. I mentioned earlier that like after I had done the video, I had taken my patient's actual like vitals for that day, and learned that my patient typically has like a stage 1 blood pressure. So I was able to create a referral for that and help them to like help to educate them too on how important that is. So I believe that even though my time limit wasn't completely met, that I still like displayed competency and like helped my patient in that manner. So to summarize, as far as professionalism goes, I would say when I meet a competent level of that because of my tone and my appearance were acceptable and appropriate. I had appropriate body language that can be improved, but it wasn't entirely poor. Just like some small improvements there that can be made. I also followed ethical considerations by getting consent prior to completing this this video for my patient. Concerning individualized care and questioning, I use effective communication with my patient. I use like clear leading questions that help to give clear responses back. Fortunately, my patient didn't need a med consult prior to this appointment. But in the future, with her high blood pressure, I would hope that she would go like be able to see a physician for that and start being treated for that. And in the future, then we would be doing med consults back and forth with her primary care provider concerning her like hypertension. Then mastery of subject matter, as far as that goes, I would say that I did exhibit an understanding of medical and oral condition by like being able to like I was able to obtain information about the medication she was taking and be able to determine if like those certain medications like probably have an effect on her oral hygiene and her oral health. And then as far as reflection goes, this self-evaluation, I thought that I was competent in that as well, since I was able to self-evaluate my performance and find some successes and some improvements that can be made. As far as the time requirement, I know that my original medical history video doesn't bump me up to 8 minutes, but with this reflection, I'm sure that I will be bumped up to 8 minutes now, which is the requirement for the assignment. So yeah, all in all, I feel like I was competent in all areas of this assignment, and I appreciate the encouragement this assignment gave us to better understand our patients' conditions and how all that relates to oral hygiene and oral health. And then also ways in which we can help our patients, such as like referrals and stuff like that. So thank you.